Pfizer has been approved here in Canada, with many expecting Moderna will also be getting the green light by Health Canada sometime this month. So one viewer wants to know which of these vaccines is less invasive and whether or not one is better than the other when it comes to certain segments of the population. Here's what our expert had to say.
So they're both equally invasive, or should I say minimally invasive, in the sense that it's simply an injection into a muscle, just like we receive other vaccinations. So there isn't any reason to believe that one of them is less invasive than the other. In terms of its efficacy for certain groups, again, we don't yet know whether one is going to be better for certain groups than the other. The big difference from a practical point of view between the vaccines is that it's much easier to ship the Moderna vaccine and to transport it because it doesn't require the -80 freezers that the Pfizer vaccine requires.
How do we know the vaccine won't affect fertility or cause birth defects, especially if they're not even giving it to pregnant women? That's alarming to me. That's what somebody just asked.
There isn't any specific reason to be concerned about fertility when it comes to the vaccine. Some of these types of vaccine have already been used in the past in very limited studies on other infectious diseases. None of those vaccines have ever come to market, so we don't have a definitive answer to that question. But again, if you look at the contents of the vaccine, none of the contents of the vaccine are known to be harmful to the fetus or harmful to people in terms of fertility. So based on that information, it appears unlikely that people are going to experience any fertility issues if they're exposed to the vaccine.
In the 1976 swine flu outbreak in the US, there was a small increase of a neurological disorder called GBS with the vaccination. Can something like this happen with this vaccine? What are the health risks people are taking by getting this COVID-19 vaccine?
Yeah, the Guillain-Barré syndrome that's associated with that vaccine and other vaccines has not been noted with this vaccine. It's certainly, again, it's possible that people may react with this, but we do not yet have evidence to suggest that that's the case. And this is based on the experience of tens of thousands of individuals who have already been vaccinated with this product during the clinical trials. We should also add that now the vaccination has started over a wide range of individuals in the UK and the US, and will start in Canada as well. We will have more data very quickly about whether or not this reaction is common.
And late this afternoon, the Ontario Medical Association discussed the top 10 most asked questions about this COVID-19 vaccine. At the top of the list, is this vaccine safe? Dr. Miriam Hanna says there's extensive work and testing that goes into these vaccines before they're rolled out to the public and deemed safe. And even after they're administered, monitoring continues. An example of that is last week in the UK, where two healthcare workers with a history of severe allergies had a reported reaction to the Pfizer vaccine. Here's more from Dr. Hanna.
When two cases in healthcare workers of an adverse reaction occurring fairly quickly after administration resulted in us looking back and saying, is there a safety signal that was missed in the clinical trial data? Is there need to further evaluate these patients or these cases to see what is it that occurred? And is there need for modification in our recommendations, or are the recommendations still safe? And this is what vaccine safety is all about. We know it's safe. We continue to gather data to ensure that it's safe.
And the experts also said that if you do get vaccinated, you're less likely to get a COVID sickness. Another question, though, was what if you do get vaccinated and you end up contracting the virus? Could you pass it on to someone else? Well, the experts don't have an answer to that question just yet, saying that they need to have more data, and that answer will come out eventually. Now, the OMA says they will be posting their full 1-hour Q&A on their social media pages. And if you'd like to view our Q&A with our expert, you can head to our website, citynews.ca.